It's really my pleasure to introduce him. You know, as physicians, we love the patients who are engaged in their own care, who learn. I think patients, we've heard over and over that patients are scared to ask questions that they think will challenge or maybe insult or aggravate their physicians. And the fact is it's the exact opposite. We love when patients are engaged in their own care, and RonFischer is one of the best examples of that that I know. He has learned. He got the professor question right. I guarantee that. He knows a lot about myeloma. We've had some great discussions about his care, and he is an extremely generous person with his time. He supports the MMRF, and he supports myeloma research. And I'm really, really happy you're here to tell your story.
So that's quite an introduction. I hope I live up to it. This is my first time speaking like this in front of a group here. And I think it's really weird that it's probably a first that we have two concert violinists referenced in one myeloma conference in one day. Dr. Charis and now me. Just so you know, this picture is not what it's supposed to be. I actually participated in a very obscure, not approved clinical trial that had a very bad side effect. As you can see, it reduced my head to half the size of my left wrist. So seriously, I've led an amazingly charmed life. You can just see I'm a professional musician, and I've spent my life with music. I have been a sponge all my life. I decided when I was 7 years old I loved the violin and I would just play it. I had no idea I'd wind up doing it as a profession, but I did. Wound up getting my first job in Vienna at age 19, and 7 years later came here, and I've been with the Detroit Symphony ever since. Also, it seems like anything I've touched, I've been in the right place at the right time. I brought my puppy to a puppy class once, and I liked the class, and I all of a sudden got involved, and won't go into all the details, but a lot of study and certifications later, I'm giving lectures on separation anxiety and OCD to veterinary college students, and you know, it's been really weird. Same with bicycling. I got on a bike, I loved it, I loved getting out into nature and going through communities, started commuting to work. It was a 52-mile round-trip commute, sometimes with my violin on my back, which my insurance company would really freak out at if they knew I'd done that. And pretty soon, you know, within a few years, and again, going through a lot of training in that, I found myself talking in front of a statewide meeting of local police officers wanting to know more about community enforcement for bicycle laws. So I've just really delved into everything. If something interested me, I wanted to learn about it, and that applies to myeloma as well. Dr. Zonder's absolutely right. He's very kind when he says I ask intelligent questions, but I'm absolutely certain that there have been a few times that he has just sort of bit his lip and thought, why does he want to know that? You know, because I'm just interested in it. You know, it's not just about what might help me. I just want to know about myeloma. And when I was diagnosed, I sort of thought, wow, this is something I can really find out about, and maybe I can do well with it. And I have. I've done really well with it with a lot of help. I was diagnosed in a very strange way. I had hyperviscosity syndrome, which means the plasma, the liquid part of the blood, not to be confused with plasma cells, had basically turned into sludge. But I had no other symptoms because I was in great shape. I was bicycling all the time. My heart muscle was pumping that sludge through anyway. But it was around New Year's, and I was shoveling snow and ice, and the combination of the exertion and the thickness of the blood caused the blood vessels in the backs of my eyeballs to go poof. And so it was kind of like a fast forward type of central vision loss and was brought to the emergency room. They first thought it was a brain tumor pressing on the backs of my eyes, but truth came out, and that was the beginning of my myeloma journey. But even then, you know, I still have a charmed life, because what happens, I find out 4 months later, because I was treated by the head of neuro-ophthalmology at Henry Ford, I'm all of a sudden the featured article with photo, because apparently, even though people have presented with this symptom, rarely has it happened, if ever, that that was the only symptom. Usually by the time you're hyperviscose, you're having other symptoms as well. So since I was unique, I am now permanently ensconced in an edition of the American Journal of Neuro-Ophthalmology, and I am famous to the probably 50 to 60 people who actually read that thing from cover to cover. All right. Oh, about treatments, I just want to, in terms of my treatments, I want to touch on the Velcade part. This was touched on before. When I relapsed for the first time, my induction was RD, Revlimid Dex, and I did very well, had my stem cell procedure, and I did not go into maintenance. And I lasted, I think, 15 months before I relapsed, and it was recommended that at that point I should go on RVD, adding the Velcade. But I had done my homework, and I knew how important playing the violin was to me, and the type of dexterity and sensitivity I would need in my fingers. And so the question became, of course, to V or not to V. And I decided not to V, and my doctor supported me entirely. He said I possibly would have gotten a deeper and more prolonged response by adding it, but I had done so well with the Revlimid Dex at the beginning, and since I wasn't on maintenance, there was no reason I wouldn't respond, and I responded very well and avoided any problems. I did later on, after my second relapse, I did go on to Velcade. That was because in the meantime, it had gone from twice a week to once a week, and had gone from IV to under the skin, and I was comfortable enough with the reduction in terms of the data of that symptom coming out that I was comfortable, and I never wound up having a problem with that. You can forget about the elotuzumab that I wrote, because that's not going to happen. You can talk to me at lunch about that if you want. It's too long a story. Yeah, it just lists all these little fun things that I've had, but a bunch of fun things. But you know, they've all been dealt with, and I flew through all of them just fine. I do want to talk about the spinal issues a little bit. If I've been on, and then I was also on Kyprolis, carfilzomib, during my third and very serious relapse. If you've been on Velcade and then you've been on carfilzomib, and you start getting symptoms of numbness and tingling in your hand, what's the first thought that comes to mind? Treatment-related peripheral neuropathy. But I'm a firm believer that if it quacks like a duck and it waddles like a duck, it might be a duck, but it could also be some crazy dude walking down Woodward Avenue in Ferndale. So what that means for me, or what that meant for me, is I did my homework. I didn't assume anything. And I had an MRI done of my neck, and sure enough, there was very serious stenosis, and was assured that if they could widen the opening, that this problem would go away. It was on the left side. The other clue was that it was just on one side, and I guess it's possible to get treatment-related neuropathy on one side, but I think that's rare. It's usually bilateral. You'll be usually on both sides. You can correct me if I'm wrong. I'm right. Good guess. Anyway, so I went through the surgery, and you know, despite what my colleagues might say, I thought afterwards I was playing the violin like a 35-year-old again. So really, not, you know, and the take-home point for this is, you know, in some cases, if you jump to conclusions and trust your doctors and how things go, but if you jump to certain conclusions, you say this must be because of this, and you shut out other possibilities, and because of that you maybe stop a treatment that's otherwise doing you a lot of good, that's possibly a loss, and that's a shame. And so my experience has been a very good one in terms of that. And you know, related to the rotator cuff surgery, right when I went to the surgeon and he looked at my history, he said, "Oh, all the dexamethasone you had, you probably weakened that rotator cuff tendon." And I said, "Yeah, I'm sure you're right, and I'm sure the 55 years of monkeying my shoulder into weird positions playing the violin had nothing to do with it." So, you know, And you know, to me, that's really fascinating because what that happens, oh, that's okay, that's good. When we allow ourselves to assume it's the myeloma, it's the treatment that's causing every little bump in the road that goes along, what we're doing is we're giving that myeloma more power over us. It's always the myeloma, and we become a prisoner to that. Instead of being open and saying, you know, it's life. There are people without myeloma who have these exact same things going on. Why can't that be my case? You know, I think it's very helpful to not fall into that trap, and it's been very helpful to me not to fall into that trap. You know, I'm on a couple of listservs, you know, thank you for posting. I'm not a doctor, but I think I can say that neither your myeloma nor treatment is causing your hangnail. You know, and I'm not too far from the truth here. I'm sure you guys have gotten patients who come in, and you go home and you tell your spouses or so, do you know what kind of question this person just asked me? And they're honest questions, and people are afraid. But I think we need to open ourselves up and not give myeloma so much credit for controlling our lives. I think if we can do that, that would be a great thing. I have, the pictures, that's my family, my wife and my 2 stepkids demonstrating 3 types of reactions to a sugar high following very high pastries and sweet drinks at an authentic Viennese cafe in Tokyo. And here, hiking in Colorado, that is not a Colorado Rocky there. It's Mount Fuji. And then here, yeah, I've been able to do all sorts of wonderful things in the meantime. All these little bumps along the road has not prevented me from doing fun things. Rizzo's my best buddy, and he's actually a good therapist for me. Anyway, this last thing about on my bike, I referenced bicycling before. That has been so therapeutic to me. Again, getting out and getting in the fresh air and meeting people, riding through Amish communities, talking to people, camping, and people curious about this guy with this bike with a bunch of cooking utensils on it. It's always been important to me. So shortly after I was diagnosed in January. April, I go in for my monthly exam, see how my induction therapy is going. My doctor comes in and he says, "You're doing wonderful." This is not Jeff, this is prior to Jeff. And you know, good news. And so I said, you know, next month I'm going to come here by bike. And he got quiet. And he brought to mind that term we all hear, new normal. I don't like that term. I think of that as a sentence more than anything else, because to me it means giving up something. And I asked him, I said, why? What's going on? Give me a good reason why I can't ride my bike. And he said, do you remember, I showed you the pictures when you were diagnosed. You had all these nice little shadows in your skull. You have lesions there. They're not going to go away overnight. What if you fall? So I'm driving home, and I'm not very happy. I'm cursing the gods and all this, and I stop at a traffic light, and I just I see this guy riding by on his bike, and I smile. And then I think, okay, wait a minute. Ron, how many miles have you ridden in the last X years as an adult? Well over 30,000 miles, all sorts of conditions. How many times have you fallen? Once in Ireland on an oil slick that I didn't see. That's it. So bottom line, next month, Charlie comes in to the exam room and he sees this 54-year-old kid grinning in his bike shorts and jersey with the helmet on the counter. And he just stopped and he looked down and he shook his head slowly and he smiled and he said, just be careful. I think that as opposed to a new normal, what's helped me and what's kept me going has been to always be able to reach back to that good old normal that we all knew and remembered, and to find times, I'm sure we can all do that, find opportunities to think, maybe have I let go of too much? Maybe have I given up on too much? Do whatever you do, check with your medical team, make sure you're not putting yourself at undue risk, absolutely. But don't assume the worst. You know, we have myeloma. You know, the goal of all of this that we're doing is really to make sure that, if at all possible, we die of something else. And so it's really, I think, very, very important that if we can reach back and find those bits of our old normal that we can latch on to and incorporate into us, when we are presented with difficulties, we'll have that little spark, we'll have that little, that little thing that we need to help get us through that and to smile along the way. And what I wish all of us is that we can keep that spark and always go forward with optimism, knowing that everybody is working so much on our behalf. I didn't have a chance yet, but the MMRF, all that they do has already been mentioned. I just want to say from the bottom of my heart, I'm thankful. I'm thankful for the wonderful people that they're able to bring here to help us and to educate us. They are a microcosm of a big world of researchers and scientists and doctors out there who are tirelessly working for us. And we are really lucky. I think we are all living charmed lives to this day. Thank you so much.